really some big changes for Medicare this next year. They have to do with the Inflation Reduction Act, so IRA, just to make it more confusing. You get two IRAs now.
Right.
But we've had provisions that have gone into effect over the past couple of years. IRA, Inflation Reduction Act, was signed in 2022. So part of that, people know the insulin savings program that reduces cost of insulin down to $35. That's already in effect. We have the maximum on prescription drug medications that was put in place this year, 2024, at $8,000. So for somebody enrolled in Part D under Medicare. And next year, the big change is that $8,000 is going to be reduced to $2,000.
Welcome to a Wiser Retirement Podcast, where we believe the best financial advice should always be conflict-free. I'm your host, Casey Smith. Guiding you to financial freedom today is my co-host, Logan Steele from Steele Choice Insurance. Hey, Logan.
Hey, Casey. How are you?
So you are our Medicare expert.
Sure. Yeah.
So was it your third or fourth time on the show?
I think so.
I think you have the record for the most attendance.
Really?
So,
nice.
Thank you for being a great resource to our clients. These type topics are always difficult. As we get older, we end up helping our parents make these choices. So really, it's not, if you're not on Medicare now, this is still a great educational piece for that, because you might be helping someone in your family who is.
Very much so. Yeah. That was going to be part of my topic today. There's a lot of noise out there. So having that kind of hand from, kids or spouses is more prevalent than I guess it has been in the past from an important standpoint.
So we're recording this right after hurricane passed through the area. Yeah. You guys are obviously okay. You're not in a low-lying area.
So our house is like on a hill. So we get a good amount of rain that comes in. And ironically enough, so maybe 3 weeks ago, we had some guys come out. They redid some work down there.
Okay.
We did have some leaking because we
had
tiebacks
in
the front of the house.
Before the hurricane?
All buttoned up before the hurricane. So expecting zero water coming in. Yeah, we still had water coming in.
Oh, no.
Yeah, we still had water coming in. It wasn't as bad as it was a few weeks ago when we had that bad storm.
Well, now you have a warranty.
That's true. Now we have a warranty. So I have not emailed them yet, but they are going to be coming back hopefully very soon.
So
How about you?
Well, we're in Marietta, so we do have a decent sized creek in our backyard, but didn't really raise that much. I think something's happened downstream.
Yeah, they fixed a culvert or something.
Something, I don't know. It just doesn't back up like it used to a long time ago when we moved in. But what was interesting is, so my daughter, I think our listeners know, my daughter rides horses. She does eventing. Yeah. And there was a show, international show, in Aiken, South Carolina. So my wife, day before, we're packing up and leaving. She's like, I can't believe you're leaving me here. I was like, you'll be fine. These things are always exaggerated. So we put the horse in a trailer and we drive to Aiken, and wouldn't you know, we get there and they have temporary stalls up. So basically just imagine plastic horse stalls with a nylon roof. Kate and I were looking at it going, I don't know about this. Yeah. And I'm looking at her like, I don't know if this is a good idea. And so she did some networking and she found a local barn that looked like, it was a beautiful barn. It was built probably in the 50s. Nice. But they cut the trees down and built the barn, kind of a thing. Okay. And like, well, there's no hurricane, so I'll take this thing out. We're good. So horse's name is, she has three, but she took Henry. Okay. So Henry gets put in his stall. He's 30 minutes from the horse show. We decide to leave the horse trailer connected to the truck and we drive to our Airbnb. So we go to Airbnb and I'm looking at weather.com and the route of the hurricane, and it's like showing right through Atlanta. I'm like, oh my gosh, this thing's going right through Atlanta. But then I flip over to ForeFlight, which is an app that I use for aviation. Sure. And it doesn't do like prediction necessarily, but it shows the more recent path and it'll draw lines like kind of headed this way. Yeah. And I was like, this is something very different. Like this is coming to me. And so sure enough, it passes very close to Aiken. I kept watching the weather at the airport in Aiken, which is right next to the horse show grounds. Okay. And the winds got up as high as 64 knots. It only reports every hour, but it also reports if there's major changes. So it kept having special reports because of that. And I was like, holy crap. Like this is, 20% of that to get the miles per hour. I was like, this is crazy.
Yeah.
And my room in the house has all like, it's like all glassed in.
Of course.
So I'm like, at this point, I go to the couch.
Yeah.
I check on Kate's like, 3:00 in the morning. She's sound asleep. She's got 2 windows. I'm like, oh, she's probably fine. So anyway, so we were supposed to leave the horse show. The horse show kept saying the whole time, it's a 10:00 start, 10:00 start.
Yeah.
And I was like, this is crazy. Like, why are these people not canceling? This is what I said the day before. I was like, you should be just eliminating Friday completely from all this.
Yeah. You would think.
Nothing. Nope. We're starting at 10. So we have to get up knowing that we have to drive the 20 minutes to get Henry, then the 30 minutes back over. Like we have to leave the house at 6. So so I get her up at 5:30 and I'm like, hey, Kate, we got to get going. It's 50-mile-an-hour winds. It's blowing like crazy outside. I'm hearing trees falling. And I'm like, what are we going to do? We got to start going to the horse show. So we're in our rain pants, our rain gear. We go outside and this big old tree had fallen on top of the horse trailer.
Oh,
and so I was standing there, the 50-mile-an-hour winds with this flashlight going, these horse people are crazy. But I'm just looking at the horse trailer going, okay, there's a dent, but on the roof, but it's sound. The inside's not crushed in or anything. And I'm thinking, how do I get this thing off? I need a chainsaw. Finally, I decided, well, it's just a horse trailer in the end. So just pull the truck forward and it'll just slide off.
Right.
So it slid off, but of course it's blocking the entire street.
Oh no.
We disconnect the horse trailer. We drive around and we're looking for any way out. And then we get an email that basically says, hey, we're going to start at 1:00 today.
Oh my God.
And so I was like, okay. And so we come back, we go back inside, dry off. And I'm like, well, 1:00, I don't know what's going on out here. I don't see any cars anywhere.
Right.
So we still have to keep trying to get out of here. So we determined that we're going to move the tree. So I take these straps that we have in the back of the truck, I strap it around the trunk of the tree, and the straps break because the tree's so big, right? And then some guy nearby was like, hey, I got some straps. And he came out with these huge straps, and we took 3 of them and twisted them together to make one.
Okay.
And started hooking on smaller branches and breaking the branches off the tree. And we get to not the main trunk, but a big, right off section right off of it. We hook it up and we pull the tree pivots about 10 feet. Some guy in a Ford F-150, all blacked out, black windows, had been sitting there the whole time. I wasn't even sure there's anybody in the car watching us. And as soon as we pull it back and we get like a 6 to 10 foot opening, he takes off. Like, dude, where have you been for the last hour?
Thanks for the help, dude.
Thanks for the help, man. So we reconnect the horse trailer. We pull out. The sun's come up at this point. It stopped raining. And we have to start working our way to get Henry. And there's power lines down everywhere. I'm driving over power lines when I can see that they're severed on both sides. So there's just complete carnage. All the power lines are twisted up in the pines. Yeah. But they were severed in multiple places. Right. So if I could see that, or if other people are driving over and they weren't being electrocuted, I was like, okay, well, this one's good. So I'm pulling a horse trailer, no horse in it. And then we get to this one final stretch of road. We were told from the people who were watching Henry that a mile down their road, a huge tree had fallen. Yeah. So the plan was we're going to get there. We have an electric bike. She's going to electric bike into the barn, ride him back out. You guys are committed to put him into the trailer, right? That was the plan. We're going to get there. You're going to ride the electric bike in. You're going to leave it. You're going to ride him out. We'll put him in the trailer. And so it was like, get to this road, Magnolia Road, I think is what it was. We got to get to Magnolia Road. So I'm standing looking at this bend in the road. There are power lines everywhere, like just a tangled mess. And nobody was coming behind us or in front of us. And I was like, well, I don't want to drive through that. And Kate, man, bless her heart, she's a great problem solver. It was her idea to move the tree. She was like, well, there's a cotton field. There's a cotton field to our right. And it was like, well, let's go walk through the cotton field for a minute and see how soft it is. It was pretty soft, but about, I don't know, maybe 4 or 5 inches down, it was a solid footing. I was like, well, let's go for it. So we put it in full drive and we pulled that horse trailer probably, I don't know, quarter of a mile through this cotton field to get to the where the road kind of turned back into the field. Then we crossed back over back onto the road.
You guys had an adventure.
And so we end up by the time we get to the lady's house, that tree that was blocking the road had been cut down by a good Samaritan. So he had chopped it up so we could get through. We get Henry. We go. It takes 30 minutes to get back. The main roads are okay. We had to do one U-turn and take a different route, but we get back to the main show. It took 2 hours to go 17 minutes. And then to get back to the horse, it was another hour, right? So we get there, we get unloaded. I'm like, man, that was crazy. I'm looking at the car, like it's a black truck. It's not even black anymore. It's just like this grayish brown color, And of course, I know mentally she's probably a mess, and they have to do this first part. It's called dressage, where you need to be calm, and there's nothing calm about any of us at this point. But
so they still continued with the horse show.
Well, no, that's just it. So we get there an hour to spare. He starts getting ready. You have to get the horse all dressed up, have to braid them and all this stuff. And they go, we are going to cancel today and move all of that today's activities to tomorrow.
Oh my gosh.
Are you freaking kidding me?
You guys had an adventure.
Like four people in Aiken, South Carolina died.
It took to get here.
I know. I wanted to walk down to the show office and be like, do you understand what it took? I mean, it was the right call because everyone mentally was just kind of strung out at that point.
The day before, yeah.
And of course, the horse was like, what are we doing? Why are we moving so much?
Poor Henry.
It turned out well. She did okay.
Okay.
She got 10th out of 18. She's riding with professionals now. So everyone there, like I think one of the people in the thing has been to like Philip Dutton had been like 8 Olympics or something. But,
oh wow! So
she's at a whole different level now.
Heavy competition now.
Heavy competition. So 10th was good. But anyway, that's my hurricane story, and obviously
one to remember.
We're praying for all the people who are in real danger up in the Asheville area. We do have clients there. I've texted with them and. They're okay, but they just said it looks like a war zone everywhere.
It's bad. It's really bad up there. Yeah, I was just talking to my sister who's in North Carolina. It's devastating up there. It's surprising they got hit so bad.
Yeah.
Yeah. Certainly thinking about and praying for those folks.
It's pretty cool to see on Facebook too. A lot of my airplane friends carrying waters and landing in grass fields and stuff to deliver stuff. So it's cool. It's so cool to see aviation community coming together, and I'm sure people locally, see if you can drive in. I don't know if you can drive in right now, but anyway, we probably should get to our topic here. We're 12 minutes into
Let's do that.
telling more stories. But let's get back on Medicare. So we are looking at some changes coming up, and I'll let you kind of start with the point number 1 here.
Yeah. So some big changes for Medicare this next year. They have to do with the Inflation Reduction Act. So IRA, just to make it more confusing, you get 2 IRAs now.
Right.
But we've had, provisions that have gone into effect over the past couple of years. IRA, Inflation Reduction Act was signed in 2022. So part of that, people know the insulin savings program that reduces cost of insulin down to $35. That's already in effect. We have the maximum on prescription drug medications that was put in place this year, 2024, at $8,000. So for somebody enrolled in Part D under Medicare. And next year, the big change is that $8,000 is going to be reduced to $2,000. In addition to that,
so that means the most anyone over age 65 would ever spend on medicine is $2,000.
Yes, as long as it's a covered medication. So it does have to be listed on the formulary of the plan. That's the key. And that's really what people need to be looking at this year is, hey, is my drug still covered next year?
Okay.
Or if you're changing to a new plan, is it going to be listed on the formulary? So yeah, as long as it's covered, most you're going to spend is $2,000 out of pocket. They're also eliminating the donut hole. Donut hole is probably the most confusing part of Medicare.
Yeah.
So it's where
that's basically what you have, where you have coverage and you don't have coverage.
Correct.
And you get really expensive and then you have coverage again.
Exactly.
Because you spent so much.
Right. So individuals right now that are in the donut hole.
How do they eliminate the donut hole?
So right now you'd be paying 25% of the cost of the medication in the donut hole.
Yeah.
Next year, you're just going to have basically 2 different phases. So you're going to have the deductible phase. Deductible, you pay first for most medications. Some plans, you may not have a deductible. Some plans, certain medications may not be subject to deductible, but phase 1 would be you're paying the full deductible amount if that medication is subject to deductible.
Right.
After that, you go straight into initial coverage phase. So you're just paying either that co-insurance or co-payment for that med up until the 2000 has been met. And that's it.
Okay.
Yeah. So, I mean, some people will benefit from this, the people that are taking those high price medications already and they're, hitting their donut hole every year. I mean, it's only about 7.5% of people are hitting their donut hole every year.
So there's like a gazillion choices when it comes to which supplement plan you want to choose.
There are.
Is it this affects every single one of them because of this, or do you still have to choose the right plan?
It is going to affect every single one of them, but yes, you still want to choose the right plan as well. So there's basically 2 ways that you can roll in prescription drug or Part D coverage. You can roll as a standalone plan. Mm-hmm. So if you have a Medicare supplement plan and you choose to go that direction versus Medicare Advantage, then you would need to enroll in a Medicare Part D standalone plan.
And if you don't have Part D now, you can add it?
Yes, you can. Yeah, you can add it during open enrollment period, which starts on October 15th, goes through December 7th. So you can do that. And quite honestly, a lot of people may consider adding it this year that have not had it before, especially if they're on a company plan. So this has been talked about a lot, but what hasn't been talked about a lot is for those people that are over age 65 that are eligible for Medicare and have chose just to continue under their employer's plan
because they're still working
or under their spouse's plan.
Yeah.
Right. Usually that's going to be considered credible coverage. Yeah. So eventually when they become retired and they move off and go onto a Medicare plan, they can send in a form that says, hey, I've had coverage since I turned 65.
Right.
They'd be able to enroll without being subject to a late enrollment penalty. But that's only if you have credible coverage, because Part D now is having a cap of $2,000. A lot of corporate plans are going to have a max out of pocket above $2,000,
right?
Which is going to make them non-credible. So in that case, you're going to have some people, even though they might have great benefits through their employer, it's not going to be considered credible coverage under Part D, which means if they were to retire, say in a couple of years, enroll in Part D, that penalty is going to start. And it accrues every single month that you go without credible coverage.
Are you curious why annuities keep coming up as a potential investment option? People are often told that annuities can effectively mitigate investment risks and help secure their financial future. However, annuities often benefit the salesperson and might not be the best choice for you as a consumer. To learn more about the various types of annuities, the negatives of owning them, and better investment alternatives, we have a free ebook on our website just for you. To download our ebook, Buyer Beware, Why Do They Keep Trying to Sell You That Annuity? Simply click the link in the episode notes or visit wiserinvestor.com/guides. Now let's get back to the episode.
Yeah, so there's 2 ways. First thing you'd want to do is go to your employer, go to the human resource department and see if they have information on this. You can also reach out to the carrier. Employer should be reaching out to their carrier. Human resources department should be reaching out to their carrier to determine if their plan is considered credible coverage or not. If it's not, then they need to send out letters to those employees that say, hey.
So this would start at the top.
This would start at the top.
Okay.
Yeah. It would
so it's
start
not
at
up
the top.
to the employee to figure it out.
Correct. Yeah. There are ways. So if HR manager or employer is kind of self-administering that, they can go online and plug in information to determine if it would be considered credible or not through CMS, Centers for Medicare and Medicaid.
Can you send us a link to that and we can add it to our show notes? Yeah, let's do that. That'd be a very helpful tool because I know we have a lot of people who are still working, but they're working in smaller businesses that wouldn't have like this HR department.
Correct. Yeah. Yeah. So for them, what's probably going to be best is just enroll in a Part D standalone plan. Yeah. Right. You can do those. There's actually several plans in Georgia that are going to be 0 cost next year. So there's no extra penalty. You do have 2 drug plans. You would still keep it through your employer if it made sense to do so. You don't have to enroll in Part B in order to have Part D.
You can just take Part D for the drugs.
Right.
Leave everything else.
Yeah. So, but you do have to have Part A. But most folks that are over 65 on their company plan will have Part A.
Correct.
Right. So you enroll in Part A, you enroll in Part D. Most people, you're going to pay 0 cost for each one of those, and that would meet the qualifications where you're not going to be penalized.
So, we talked about this before, but when you're moving into all this, so if you're just signing up for Medicare this year, what, is searching for the right policy still the same? Where we're just, because I just feel like what you do is you go through, what drugs are you on? You put in the drugs, and then that directs you as to what supplement you should be buying.
Yeah, drugs are certainly a big part of it. You can plug in those medications. You can go to the Medicare website and it'll give you estimated costs for it. Like to do a little extra research, see if you might be able to get it cheaper through GoodRx or another program. But yeah, that's a good place to start for individuals. They'd be able to look at both Medicare Advantage and prescription drug plans through there. Medicare Supplement is going to be separate. So you have those going to be administered by private insurance companies. Plan G is what most folks are on, but there's kind of the full alphabet of products when it comes to Medicare Supplement. Right. But yeah, prescription drug is going to be a bigger part this year. That's what people need to focus on, whether they're coming in for the first time or they're renewing, especially if they're on Medicare Advantage plans. Okay. So that's going to be a big part of it. Yeah. Right. We have I was going
to ask you what the impact on G plans and the bigger plans were.
Not much. Yeah, not much. We're certainly seeing some higher increases than maybe we've seen in the past, but there's still most of them within the single digits increase. So not too much is affected. If someone's on a Medicare supplement or chooses to enroll in Medicare supplement for the first time, they won't see a big difference there.
Okay.
Yeah.
What else is on your list here?
So Advantage plans, if someone is on an Advantage plan, especially in Georgia, Atlanta area, we're seeing a lot of carriers that are exiting plans. So basically with Medicare rules, if they change the plan by a certain percentage amount based on their metrics that they use, then they cannot auto renew those individuals. They would not be able to map them over to a new plan. That plan would exit, and then they would have to actively enroll into a new plan. So we have a lot of folks in the Atlanta area that are on excellent plans right now. Those plans are going to be ending. Many of those have received their letters here in the last couple of weeks. They will have extra time to enroll in a plan, but if they do nothing, then they will revert back to original Medicare on January 1st, and they won't have any prescription drug plan. So it's very important that they do something by December 31st. They have passed the December 7th deadline. So December 7th is going to be for most people that are renewing, but they'll have until December 31st. They actually have some time after that, but if they want a January 1st effective date, they'll need to make that change by December 31st. The other nice thing with that, silver lining to that rather, would be if someone wants to enroll in a Medicare supplement plan who has not had one before because of health conditions, then they would be able to get a Medicare supplement. So for those folks, again, this could be a silver lining for them. Coming off a Medicare Advantage, it allows them a guaranteed issue for Medicare supplement. But again, we'd have to put that application in time. Make sure that, if you are in that situation, they would need to save that letter, either from Aetna or Humana or United Healthcare, whichever carrier it is that says that your plan is exiting. Take a picture of that, keep it in a safe spot, because we'd have to send that in along with the application to the Medicare supplement carrier to verify that they had a loss in coverage.
Okay.
Yeah.
All right. Part B premium. This is the part that comes out of Social Security, or if you're not on Social Security yet, you pay it directly. Increasing from, was it $170 to $185 a month?
Yeah, it's $174.70 right now. They haven't announced exactly what it's going to be next year. Right now, it's estimated to be at $180, but that should come out in the next.
What percentage is that? You have a
increase?
Yeah.
So what? Maybe
somebody got a calculator?
2.5%, 2%, something like that.
Okay,
I'm best.
All right. No calculators here. Sorry.
Yeah.
Yeah. Okay. I was just wondering so CPI, Social Security increases based on the CPI, right?
Right.
consumer price index. So a lot of times what we see is Medicare is climbing faster than what even people are getting paid, but probably a 2% increase in Social Security, if I had to guess. That's kind of where we're landing on inflation right now. Right. 2 to 2.5. So they're probably, your net paycheck will be about the same. So is what it sounds like to me.
Right.
They're going to take more out of your Medicare, but then increase your.
Exactly. Yeah. And there's provisions in place where if someone is in maybe kind of receiving a lower benefit, their increase in Part B can never be more than the increase in their Social Security.
Oh yeah?
Yeah.
I've never seen that implemented.
Yeah. Those are the rules on it. I haven't seen it implemented either. But those are the
It may be a situation that we don't know anybody that would be in that situation.
Right. Probably not. Yeah, probably not. They would have to be at a lower Social Security level.
Right. Exactly.
To see that difference. Right. Yeah. From a dollar figure, not from a percentage figure.
Correct.
But
yeah.
Yes.
Exactly. Probably not a wealth management client.
Right. Probably not.
All right. What else you got?
Sure. So a couple of things, people have heard that Medicare is going to begin negotiating drug prices for certain medications. So they did come out with that kind of top 10 list, these name brand medications that are very popular, very expensive. So that won't take effect until January 1st of 2026. We still got a little bit of time on that. But I know that's kind of out there and people think that might go into effect this next year. It's really the 2000 max is what people need to look at. So, this is a time when people really need to look at their drug plan, make sure their medications are still going to be covered for this next year. If they're on a standalone Medicare drug plan plus a prescription drug, I would encourage them to go to the Medicare website, make sure that medication is going to be listed on the formulary for the next year. Some plans are increasing substantially. So we have one plan with Aetna that's going up more than doubling this year. So everybody should be receiving those ANOC letters, the annual notice of change.
Yeah.
It'll show what the premium is this year versus what it is next year. It'll show the changes in deductibles and copays. Yeah. So a little more important to look at this year.
Yeah. I know you have a note here too, related to that is fraud.
Yes.
My grandfather was on one plan. I have all his information. I'm in charge of his well-being. And one day we were told that card didn't work. He didn't have healthcare through that company.
Wow, that does happen.
And I started doing some research. I started going through the mail.
Figure out what it was. Yeah.
And I was like, "You're with United now. How did this happen?" He has no idea. I ended up calling United, figure out who the agent was. I said, "Do you know this person?" No, don't know this person. We have no idea. Now there's some dementia there. So they could have gone door to door, could have knocked on the door and got them to change it. That's pretty aggressive, I would think, for something like that. But the agent was not in the area. There was no Georgia address for what, isn't that crazy?
It's crazy. And it happens. And I've had it happen to a bunch of my clients. Unfortunately,
they don't know they're switching, but
they don't know they're switching, and then they just get a card in the mail. So I've all these meetings, all the broker managers I've been speaking with each of the carriers, they're expecting the highest level of fraud this year than we've ever seen because we have so many changes, especially in Georgia.
Right.
And a lot of the people listening are probably already getting calls from folks. So there's very strict guidelines when it comes to Medicare marketing for these types of plans, but there's just blatant disregard for those guidlines. So, you can't make any cold calls if you're getting a cold call, especially
really?
Right.
They don't allow.
They do not allow cold calls.
But that happens all the time.
It happens all the time.
Yes, I have. Yes. I changed all his contact information to my number. I get these calls all the time.
Right.
That's crazy.
So
I had no idea
you
that
can
it was
for
illegal.
Medicare supplement, but not for Medicare Advantage or prescription drugs. So they try to find little loopholes around that. In addition, you can't make any sort of marketing calls for the next year's plans until October 1st. So a lot of my clients have been calling and saying, "Oh, I heard about this new plan for 2025. I was like, well, how did you hear about that?"
Right.
Yeah. So anybody that's calling you, chances are, one, they're probably not in your area. They don't know the hospitals. They don't know Emory and, St. Joe's and Piedmont and kind of where those providers are. And quite honestly, they get paid just by switching you to a different plan.
Right.
So a lot of it is really doing your homework or working with somebody that you know and trust that can help make sure that you're on the right plan. But yeah, unfortunately, it happens out a lot with older folks. Do not supply your Medicare number to anybody over the phone if you do not know them.
Yeah.
Yeah. And that's the biggest thing. Once that your Medicare number is out, there's just bad agents, unfortunately, that will just enroll somebody into a random plan. And it's very difficult. It's almost a slap on the wrist when you do report them. Yeah.
Well, in our case, the plan was okay. So we determined that, okay, we'll just stay here.
Yeah.
I probably need to switch it to you now because that just makes me angry that's how I got there. But
unfortunately, yeah.
Yeah, that's crazy. Well, I will say that this can all be somewhat complicated. I mean, it wasn't until I kind of got involved in his situation and even my mom's that understanding how all this really works. And if you're confused by all this, just know that we as planners call Logan. That's what we do. We explain all the basics and what you need, what the deadlines are. But when it comes down to specific plan information, there is just no way a planner is going to be able to stay on top of that and all the other stuff that we have to stay on top of. So this is a case where we have experts. We have experts in, term insurance. We have experts in long-term care, and we have an expert here in Logan in doing the Medicare project. So thank you for doing that. Also for our early retirees. I know we have a couple of clients that have probably more than that. That you're helping get healthcare until they turn 65, which is no small feat right now. That's a difficult area to navigate, especially if you have health issues.
Correct. Yeah, it really is. And the costs have just gotten outrageous. So, happy to help out those folks as well that, go with individual plans. There's a lot of changes there. That's maybe another podcast, but
yeah, we probably should do that. Healthcare prior to 65. That could be a whole new podcast that we could do there. I'm looking at Hadley across the room here. She's adding it to our list. All right. Anything else for this episode, Logan?
I think that's everything. So yeah, I appreciate you having me again, Casey.
Other episodes, if you're interested in learning more about this type topic, episode 188, current state of healthcare, Medicare open enrollment with Logan Steele, episode 255, key things to know about Medicare enrollment, as you're coming up on that. We also have a YouTube channel, A Wiser Retirement. What is IRMAA? IRMAA, all caps. Let's watch the video if you want to know. Medicare sign up process explained. We have a video about that. We also link to Steele Choice Insurance. If you want to reach out to him, please do so. Logan's very good with his communication skills, and we'll get right back to you. Thanks for listening. If you have any, want to meet with a financial advisor at Wiser Wealth Management, you can do so by going to wiserinvestor.com or following the show links. You guys have a great week. We'll see you next time.